I think there are few trials which are kind of working or presenting on the real world care intensity metrics in the with immune checkpoint era in the lung cancer, which had definitely transformed our patient survival. So um, we have data coming out on patient who gets immunotherapy um, when they are in the hospital, or how that integration with the palliative care leads to the patient's survival outcomes. Because in the past, we have seen that patients which gets immunotherapy when they're in the hospital had a poor survival. So I think I'm excited to see how this real world data shows that. And also, I think there are a couple of trials we're going to report on the patient reported outcomes. I mean, I'm a as a clinical oncologist doing all these trials, but my interest or my interest also lies in patient reported outcomes and the um, overall health of the patient with their quality of life. So um, there are now the trials which are looking at patient-reported outcomes and caregiver burdens and how they align with the outcomes in the study. So I'm excited to look at some of these real-world data at this World Lung Cancer Conference. We should appreciate World Lung and the trials nowadays, which are enrolling patient advocates, or which are in the trial committee, and also kind of reporting on the patient-reported outcomes, which wasn't a norm in the past. So I think that's a big shift that we are seeing, which is really good for the patients. The data, what we're seeing in lung cancer is evolving at such a rapid pace. Like pretty much every other month, we're seeing updates in the guidelines. There's so much data coming out. So these conferences that try to help us keep us on board, or like try to keep us on track with all these newer development that's been happening in the lung cancer realm. Again, which is otherwise it's going to be so hard to keep up with that because there's so many, as I said, like so much newer data coming out every other month. And also, I think other than that, it's the bigger. I think the bigger lens with that is like able to collaborate with other researchers, collaborators, able to meet them, learn from them, finding and meeting them, kind of really make this a niche community in the terms of uh, able to reach out to and collaborate with the other investigators on the trials. And these conferences and small gatherings serve as a real springboard for early career and also people who are interested in different trial, which aligns with their goals, to connect with the peoples that kind of work in the same um, the kind of area expertise. So I think that's really helpful. So I think learning new data is great. We can get all this, but I think the meeting the person, interactions, collaboration, that really is, I think, the biggest takeaway from these conferences.